All right. So to present our second resource speaker, he is a senior public health professional for 20 years with an in-depth experience in community development and program management. He has extensive experience on country-level program and project startup, leadership and technical support on maternal and child health, family planning, adolescent sexual reproductive health, HIV, and COVID-19. So since 2019 to present, he is working with the Child, Adolescent, and Maternal Health Division of the Department of Health to support adolescent-focused initiatives. He is also an advocate for teen pregnancy, HIV prevention programs, sexual reproductive health, and youth engagement. So for all of our participants and Facebook viewers, may we give a round of applause to Dr. Miel Filomeno Nora, who will share us a topic about teenage pregnancy in the Philippines. Welcome po, Doc Miel. Good afternoon.
Hi, good afternoon. Is my sound clear?
Yes po, loud and
Okay.
clear.
So mula sa kagawaran ng kalusugan, ang aming pong pakikiisa sa International Day of the Families. Magandang hapon po sa inyo lahat. Esteemed colleagues and distinguished guests, I'm going to discuss to you the situation of teenage pregnancy in the Philippines. So in behalf of the Department of Health, it is an honor to present to you a pressing issue that continues to impact the lives of many young people in the Philippines. That is teenage pregnancy. Maalala po natin, way back 2017, 2018, nasa top 5 po ang Pilipinas sa pinakamaraming mga babaeng bata na nabubuntis. And it affects not only the health and well-being of young mothers and their children, but also posing significant social, economic, and development challenges of the country. Ang teenage pregnancy po ay hindi masusolusyonan ng isang kagawaran lamang o isang ahensya ng gobyerno dahil ito po ay multifaceted issue with various factors contributing to its prevalence, including limited access to comprehensive sexuality education, inadequate reproductive health services, and deeply ingrained cultural norms and practices. Kasama na po dito ang child marriage. The consequences of teen pregnancy are far-reaching, often perpetuating cycles of poverty, limiting to educational and career opportunities, and increasing the risk of adverse health outcomes for both mother and child. Apektado po dito yung nanay at ang kanyang anak. As we deep dive, we will discuss potential solutions, current initiatives of the Department of Health that can be employed to reduce its prevalence and improve the lives of young people and their families. Next slide, please. So at present, the Philippines has large population. Nabanggit kanina ang total population ng Pilipinas nasa 111 million. Okay? So with around 28% of its population composed of adolescent aged 10 to 24 years old. Imagine these 10 to 24 years old are the future drivers of our society. Sila po ang magiging magulang for the next generation. At kung sila ay mabubuntis ng maaga, maging batang nanay o batang tatay, the country might face a lot of challenges affecting the well-being and development of young people, including poverty, inadequate access to education and healthcare, and social cultural barriers. Among adolescents in the Philippines, this is a significant issue in the Philippines, that is teenage pregnancy. The Philippines has one of the highest teenage pregnancy rates in Asia. Nabanggit ko po kanina, 2017, 2018, nasa top 5 tayo, with 10% of girls aged 15 to 19 years old already given birth or pregnant with their first child. Imagine yung first child, pag nabuntis, muli, second child, adolescent pa rin siya, nadodoble po yung ating statistics ng batang ina. In the most recent YAPS, ito po yung YAPS, Young Adult Fertility Survey, ang coverage po nito ay 15 to 24 years old. The percentage of female youth aged 15 to 19 have begun childbearing has declined from 13.6 to 6.8. So this is good news. Bumaba po ang bilang ng mga batang nanay sa Pilipinas, as well as the rates of unintended pregnancy and abortion. At ito po ay sinigundahan ng National Demographic Health Survey, which results and revealed that teenage pregnancies have declined from 8% in 2003 to 5.4% in 2016. So ibig sabihin po, bumababa yung bilang ng mga batang ina sa Pilipinas. However, ang medyo alarming po sa kasalukuyan, tumataas naman po ang bilang ng under 15, yung 10 to 14 years old. Okay? At kasama rin po sa problema ng mga adolescent ay mental health. Maaring related po to sa teenage pregnancy. Mental health is also a growing concern among Filipino adolescent. Studies show that around 10 to 20% of youth experience mental health problems, including depression, anxiety, and suicide ideation. There is still a lack of mental health services and resources available in the country, particularly in the rural areas. Next slide, please. So kung makikita po natin sa Young Adult Fertility Survey, sa National Demographic Health Survey, at sa Philippine Statistics Authority, sinasabi po sa report na to that registered live births and adolescent birth rate among women aged 15 to 19 years old are declining over the past 6 years. However, an increasing trend are evident among under 15. Ito po yung sinasabi ko kanina na tumataas ang bilang ng mga batang buntis sa edad na 10 to 14 years old. Sa kasalukuyan po, kinakailangan pa natin mag-deep dive, magkaroon pa ng malalim na analysis kung ang pagbaba po ba ng ating mga batang ina ay dulot ng lockdown sa COVID-19. Ito po ay kinakailangan pa nating pag-aralan at masinsinang analysis. Next slide, please. In support to this data, like what I mentioned earlier, the 2022 National Demographic Health Survey revealed that adolescent birth rate is now 25, dati 47, now 25 per 1,000 women, which is almost half from 47 in 2017, and that's good news. And going beyond the national target of 37. The average female who have begun childbearing also declined by almost half from 9% in 2017 to 5%. So ibig sabihin, either maganda ang programa ng gobyerno o kaya maganda ang pakikipagtulungan ng bawat ahensya para solusyonan ng teenage pregnancy or maaring i-attribute rin natin ito sa COVID-19 lockdown. Next slide, please. Okay, sino naman ang mga top-notcher at matataas na bilang ng mga teenage pregnancy in terms of by the region? In 2022, there were 5.4% or 5,531 of women 15 to 19 years old of age who have ever been pregnant in the country. In Cordillera Administrative Region, teenage pregnancy was 6.1% in 2022, an increase of 2.6 percentage points from 3.5% in 2017. Meanwhile, pareho pa rin po ito ng way back 2017 and 2018, Northern Mindanao had the highest teenage pregnancy with 10%, followed by Davao Region with 8.2%, Central Luzon with 8%, and Caraga with 7.7%. At sino naman po ang mga may mababang rate of teenage pregnancy with 2.4%? Ito po ang Ilocos Region and Bicol Region. Next slide, please. So women 19 years of age had the highest number of teenage pregnancy. Ulitin ko po, among the age group of 15 to 19 years old, women age 19 recorded the highest incidence of teenage pregnancy in 2022 with 13.3%. This was decrease of 9.1% point from the 22% in 2017. Pregnancy among women age 18 was 5.9%, 17 years old women at 5.6%, and 16-year-old women at 1.7%. Meanwhile, women 15 years of age had the least number of pregnancies at 1.4%. In general, teenage pregnancy declined from 8% in 2003 to 5.4% in 2022. At ano po ang mukha ng mga teen pregnant mothers? Again, ito pa rin po yung mga tinatawag natin nakatira sa rural areas at less ang kanilang education. Next slide, please. Now, just to give you the result of the Young Adult Fertility Survey of 2021 done by UP Population Institute. Ito lang yung mga highs and lows ng ating latest survey. Last survey was in 2013. So sexual initiation happens before the age 18. In terms of wantedness of premarital sexual initiation, more than 53.7% of male wanted it to happen at that time, while almost half or 44.9% for female. Sexual initiation among youth happens prior to marriage, and male has slightly more sexual experience than female. Mas mataas daw po ang sexual experience ng mga kalalakihan kaysa mga kababaihan. There are youth aged 15 to 24 years old who are already engaged in highly risk sexual activities such as casual sex, male sex with males, sex with FUBU, 5% males and 0.4% are females. Ano po yung highs o kaya good news ng young adult fertility surveys? Percentage of female youth aged 15 to 19 have begun childbearing declined from 13.6 to 6.8. Ulit-ulitin ko po, bumaba. Unintended pregnancy and abortion also declined. 9 out of 10 pregnancies resulting in live birth receive antenatal care. So siyam sa 10 pagbubuntis nakakatanggap po ng prenatal care. So yung mga batang nanay, kumukonsulta sila sa ating mga facilities para sila ay mapangalagaan yung kanilang mga bata sa kanilang sinapupunan. 61% of antenatal care happened in the first trimester, representing 10% increase from 2013, and 73% had at least 4 antenatal care. So, ibig sabihin, yung mga batang nanay nagpapakonsulta po talaga. So, ano naman po yung mga lows ng young adult fertility survey? Healthcare challenges, nandito pa rin po. 4 in 10 female youth had live birth encountered at least one challenge. Ano po ito? Accessing prenatal or postnatal healthcare services. Ano po ang mga barriers natin? Distance and transportation. There's also a low number of male and female that consult to health professional for their reproductive health problems. Kakaunti po o hindi ganun kalaki ang bilang ng mga kabataang lalaki at babae na kumukonsulta para sa kanilang problema sa sakit na reproductive or issue about reproductive health. At tumataas po ang suicide ideation and attempts noong 2021. So ito po yung mukha ng mga ating young adult 15 to 24 years old. So hindi po kasama dito yung 10 to 14. Next slide please. So ano po yung ginagawa ng kagawaran ng kalusugan kasama ang mga iba't ibang ahensya ng pamahalaan? We supported the EO 141 which calls for the implementation of measures to address the root cause of teenage pregnancy. We also institutionalize and standardize the quality of health service delivery in all women and children protection units. Ito po yung mga nanay at mga batang ina na apektado ng violence sa loob ng kanilang bahay. Sinusuportahan po ito at nire-revisa ngayon ng Kagawaran ng Kalusugan. At meron po tayong AO 2022 Omnibus Health Guidelines for Adolescent para mapabuti ang serbisyo ng mga kabataang babae at lalaki. Kasama na rin po ang LGBTQI. Next slide please. So ano po yung mga key interventions po natin sa kasalukuyan? To address this critical issue, it is essential to implement evidence-based strategies and interventions that only focus on preventing unintended pregnancies among adolescents, but also provide support and resources for those who are already pregnant or parenting. Siya nga po pala, marami po ba ditong nanay? Happy Mother's Day po yesterday at sana po yung mga batang nanay, batiin pa rin po natin. This includes promoting comprehensive sexuality education, improving access to youth-friendly reproductive health services, and engaging communities and families in supporting young people's sexual reproductive health. Ano po yung mga key intervention na currently ini-implement ngayon ng Department of Health? Would like to set standards for adolescent care and services. Ito po yung tinatawag naming adolescent-friendly health facility na kung saan may level 1, 2, and 3 para suportahan, bigyan ng budget ng lokal na pamahalaan para mabigyan ng serbisyo ang ating mga adolescent boys and girls. We also have research dissemination for advocacy. We also have capacity building, and we integrate adolescent service and thematic events of other government agencies. Kung maalala niyo po, meron tayong tinatawag na linggo ng kabataan. We also do social behavior change and communication, and we also have the CSE-ARH. Ito tinatawag po nating Comprehensive Sexuality Education, Adolescent Reproductive Health Convergence. Kapartner po natin dito ang POPCOM, Commission on Population and Development, at Department of Education para masigurado na mga kabataan natin ay may tamang impormasyon, ang mga teachers ay may kakayanan na magturo, at meron din po sila mga materials na gagamitin para turuan ng mga kabataan at nag-establish rin po tayo ng referral mechanism o directory para alam kung saan dadalhin ng mga batang may problema patungkol sa reproductive health. Next slide please. Gaya na nabanggit ko, ito yung mga key interventions natin na sinasabi ko kanina. We support in the IRR of child marriage, RA 11596, which was signed into law in December 2022. We also submit position papers for pregnancy bills, and we'd like to integrate adolescent sexual reproductive health in the Omnibus Health Guidelines for Adolescents. Ano po itong Omnibus Health Guidelines? Ito po yung overarching policy integrating key policies, provisions such as adolescent reproductive health, governing various health programs, integrating various standards of care. And kabahagi din po ang Department of Health sa RPRH Multi-Sectoral Strategic Planning, which includes adolescent sexual reproductive health. Kasama rin po natin ang PAPCOM through Visual Parenting Talk, Kapit Kamay Declaration with NEDA and DepEd. And sa kasalukuyan po, meron na po tayong 1,420 adolescent-friendly health facilities sa buong Pilipinas na po pwede magbigay ng serbisyo para sa mga kabataan. Next slide, please. Ito po para sa mga magulang, sa mga kabataan, meron po tayong in-establish or brand ang Department of Health for Adolescent, ang tinatawag po nating iChoose. Pwede nyo po siyang i-search sa Google, sa Facebook, at pupunta po kayo sa isang page para bigyan kayo ng tamang impormasyon patungkol sa sexual reproductive health, HIV, and mental health. Meron din po tayong platform, konektado tayo sa Facebook kung saan po pwedeng magbigay ng payo ang kapwa magulang base sa mga problemang kinakaharap ng mga kabataan. At ito nga rin po sinasabi ko kanina, yung Young Adult Fertility Survey na kung saan binibigyan ng muka ang mga adolescent para tama ang programang ibigay natin sa kanila. So konektado tayo, ulitin ko po, is an initiative to bridge the communication gap among parents and their adolescent children on issues concerning adolescent sexuality and development. Sana gising pa kayo nakikinig sa akin. Next slide. Okay. So, napaka-popular po to sa bawat region, yung Linggo ng Kabataan. This is a popular platform for CHD sa mga regional Department of Health to advocate for the needs of adolescents and influence the decision of the local government unit on the issue of teenage pregnancy. And then we also advocate na sana patuloy pong suportahan ng mga local government unit ang adolescent-friendly health facilities. Meron din po tayong Sexual Reproductive Health Playbook. Ito po ay guide para sa local government unit paano pa ipatupad ang adolescent sexual reproductive health programs at the local level. And gaya na banggit ko po kanina, yung CSE-ARH convergence with stakeholders to ensure that all in-school and out-of-school youth understand comprehensive sexuality education. Next slide, please. So for the next year, we'll continue with the research dissemination for our advocacy. We'll continue with the youth engagement. We're going to have a virtual collaborative meetings with our non-government agencies and local government units. At patuloy po natin sinusuportahan ng mga Mothers Class and Forum for Adolescent Pregnancies. At meron din po tayong mga virtual parenting talk. Kakapartner po natin mga development partners natin, gaya ng USAID, Rich Health, and WHO. Next slide, please. Department of Health is in partnership with partners and community for the provision of health service package. When we say health service package, ito po ay mga customized na pangangailangan ng mga kabataan in an adolescent-friendly health facility. Kasama rin po dito ang pagbibigay ng kakayanan sa mga health service providers. So yung mga ating po mga doctors, nurses, and midwives, they can train online via DOH Academy. Meron po tayong mga foundational course on adolescent health for primary care service providers. Pwede rin po ang ating mga teachers na mag-online course doon sa DOH platform ng Kagawaran ng Kalusugan. And we also establish evidence data for development of policies and guidelines, and we strengthen partnership and collaboration. Next slide. So in moving, ano po yung mga tinatawag nating mga kasalukuyan nating mga challenges? Sa kasalukuyan, ito pa rin po yung kinakaharap ng mga adolescents natin. Adolescents often do not get health services they need because of distance from the facility, lack of awareness about the services that are available, and lack of adequate equipment of the facility. Ito pa rin po ang major challenges po natin. Ano po? Na sinusulong po natin na sana ang mga minors hindi na kinakailangan ng parental consent because minors still need parental consent to access family planning commodities. And there's also insufficient data on adolescent risk assessment and mechanism for data submission. Another challenge is health facilities and programs for adolescents were not prioritized, especially during pandemic. So adolescent and youth had no access to health and social services during lockdown or community restrictions. At mababa pa rin po ang level ng health-seeking behavior among adolescents, which is evident in both RH and primary care service providers. Next slide, please. Ways forward in addressing teenage pregnancy. Again, ito po, uulit-ulitin ko, this is a whole of government approach. Kinakailangan pong tayo magtulungan. We need to support provision of health service package in adolescent-friendly facility. We need to continue to support our service providers by providing them trainings in implementation of adolescent programs. We need to have an established evidence-based data for the development of policies and guidelines. At napakahalaga po nito, hindi po kaya ng Kagawaran ng Kalusugan, Department of Education, o Commission on Population and Development, and DSWD. We need to strengthen the partnership and collaboration with our and development partners. Next slide. Nabanggit ko rin po ito kanina, meron po tayong hashtag, website and Facebook page na tinatawag nating I Choose Malaya Akong Maging. And we would like all our policies are designed to ensure all adolescents, including boys and girls, in normally humanitarian settings are protected and provided with care. Natuto na po tayo ng panahon ng pandemic na naging reactive tayo. We want programs and initiatives that are proactive kahit normal or humanitarian settings, handa tayong magbigay ng serbisyo sa ating mga kabataan. Sa isang pasilidad na equip, handa ang ating mga service providers. Next slide. So, the Department of Health would like to have an accessible, comprehensive primary care for every life stage, child, adolescent, adult, and elderly. Next slide. I kept on telling this sa mga talks na binabahagi ko. Adolescent girls and boys are our future drivers of our society. They are the ones who will become future parents. Sila po ang future parents ng ating bansa. They are the ones who will make decisions about their own families and well-being. We need to invest in adolescent programs. We need to empower them to make responsible choices about their lives and prevent teen pregnancy. Next slide. Okay, mula po sa Kagawaran ng Kalusugan, maraming pong salamat at ito po ang mukha, numero ng ating mga kabataang babae at lalaki sa kasalukuyang panahon. Muli ang aming pong pagbati sa International Day of Families. Magandang hapon po sa inyong lahat. Thank you.